away, Shannon.
Hello, everyone. So I'm Shannon Minnick. I am the Deputy Director of Independence Now, and I'm so excited to be here with you guys today. I am going to start sharing my screen. Yeah. I hope all of you guys are doing well and excited about being here today to learn all about the EID program. Like, this is a wonderful program, you guys. It's so wonderful that I even use the EID program. So just to talk a little bit about Independence Now, because that's where I work. We advocate and embody independence and equality for people with all disabilities. We advocate, well, we serve people living in Montgomery County and Prince George's County. So just to jump right into the EID program, the EID program is really known as Maryland's most powerful work incentive. It really does change the lives of people that are looking to go back to work and that are working with disabilities. So it's a great program. And it's also known as the Medicaid buy-in program. EID is a work incentive that provides Medicaid for limited premium to people with disabilities that work for pay. Trying to see if I can move this up some. There we go. So the EID program covers personal attendance services, community-based psychiatry services, and a variety of other community supports for other that other insurances rarely ever pay. The medical assistance pays for premiums. I know a lot of times, well, folks with disabilities have SSI or SSDI, and so they have to pay for Medicare. So the EID program will actually pay your Medicare premium. Okay. Who is eligible for EID? You must meet the Social Security medical disability criteria, be a US citizen, a qualified alien ages 18 to 64. You must work for pay. So you can't babysit and not pay taxes and things like that, and get EID. You must be an individual that's working and that is paying taxes, okay? You must meet the income limit and meet the resource limit. You may meet the disability standard if you currently receive Social Security disability, formerly received Social Security disability or SSI, and an adult, and has lost benefits for reasons other than medical improvement, right? So people with Social Security medical disability standard but are not eligible for SSI or SSI due to non-disability. So that just means, you meet the criteria as a person with a disability, but you may not have received SSI or SSDI. So you must come up with a letter from your doctor saying that, yes, this is a person with a disability, and EID will accept that, okay? So there's no minimum level of earnings. Some people have enrolled or earned as little as $50 a month. That's unheard of, right? So $50, that may be an hour or 2 or even 3 hours of pay a month. So that's very little, and you still can qualify for EID. Earning must be legal, as I stated earlier, and subjected to taxes. You may be employed or self-employed. So I've helped several people that are self-employed to apply for EID, and they have been accepted. Paid work, again, enrolled in an employment If enrolled and then employment, loss, or medical leave of 30 days, you may remain on enrolled EID for up to 6 months. So this just means, so if you were receiving EID and then you lose your employment, you can still pay up to 6 months of EID premiums and still get EID for up to 6 months. And also, if you have lost wages, they can reduce the amount of money that you pay for your premium for EID. So the income limits for EID for one person, now get this, you guys, you can make up to $69,000 and $69,972, mind you. I usually just say $70,000 if you're one person. That's a lot of money, right? To earn and still qualify for the EID program. So if you're two people, husband and wife, and or wife and wife, or husband and husband, or just you and your significant other, you can earn up to $94,000 and still qualify for the EID program. Again, this is the one that always gets everyone, is meeting the resource and the assets limit. So you can have up to $10,000 in your savings account or your bank account together and still qualify for the EID program. And if you're married, up to $15,000. That's still a lot of money, right? So these resources include cash, bank accounts, investments. They do not include certain retirement accounts or motor vehicles and the primary residence of the couple. Not all income is count. Okay, so income, the only income for individual, the only income that counts is the individual and the spouse. So not the kids, the grandma, but just the individual and their spouse, okay? So, but not all income is counted. So they take your income and they subtract $20 per month from earned or unearned income, because you can still receive Social Security, SSDI, and work and qualify for EID. If they take those two incomes together, and as long as they don't come up to that $70,000, if it's one person, you still qualify. And remember, please, if you have questions, I know I'm going through this pretty quickly. If you have questions, please put questions in the chat box. And if I don't get them today, I will respond to them in the near future. So after they take the $20, subtract the $20 per month, then they will take $65 and the remainder subtraction from the earned income. This is all really a little bit confusing, but when you meet with me or an IO specialist, independent living specialist one-on-one, they can go into depth what this means. Disability-related expenses needed for work and paid by the worker. So that means if your employer pays it, then that doesn't get deducted, okay? Any work-related expenses paid by blind workers. Premiums paid by the workers for employer-sponsored health insurance. So if you have health insurance and your employer is paying for it, then that doesn't get subtracted from your income. How much does it cost? Everybody wants to know this, right? How much does it cost? It's very, very inexpensive, and they make it that way. So the important thing about this is a subsidy to allow people with disabilities to go back to work and not have to pay, you know, $200, $300 a month for insurance, because that's very costly for individuals with disabilities, right? So what is a monthly premium? It is the cost you need to pay each month to be enrolled in the EID program. And I'm just gonna, you know, tell my business a little bit. I paid $50 a month for my EID buying Medicaid, and I'm the Deputy Director of Independent Living Services. So it's very affordable. How much will you pay monthly? How much will my monthly premium be if I am approved? Now this varies. Everyone won't pay $50 a month. Some people pay $0, some people pay $25, others pay $40, and some pay $55 per month. So this is the chart that they use, right? So it works on a sliding scale, and if they'll take 100% of the federal poverty level, subtract it by the premiums, and come up with the costs. So that's how they come up with the $25, the $40, or the $55 a month. And like I said, I'm not really good with numbers, but we can help you figure this out in a one-on-one setting. But this is the formula that they use to come up with what your premium would be. Premiums may be waived temporarily in cases of extreme hardship. So this program is made so it's not causing a hardship on the families, right? So paying would require forfeiting food, shelter, clothing. So things like that, we want to make sure that people are eating and people are still, have shelter and clothing to go to work. So they break down those premiums, to make it affordable for the family so it doesn't cause a hardship. Once enrolled, if eligible, the Medicaid will start retroactive. So when you put in your application, whatever it is, the date that you put on that application, it goes back to that date. Now, if you have your application and you start filling it out January 1, and then you don't submit it until, June 1, then it's not going to be retroactive because you waited 6 months to even submit the application. So when you start on this application, be mindful and be ready to submit it, and submit it with all the information that's requested so things can start moving. Okay, EID provides fee for service, so it's not necessary to join a managed care organization. And those they have many rules and many things that you have to follow, but because it's a fee for service, you can just use your Medicaid wherever it is that you go to receive services.
Shannon, I wonder if
Yes.
this might be a good time for a few questions. We've gotten some in the
Yes, a
chat.
break for me. Woo.
All right, great. So let's see. If your resource is higher than 10,000, you can put the amount into an ABLE account, correct?
Correct.
Okay. Can parents hire disabled children to do some housework and give their child money as income if the child qualifies for EID?
Oh, that's tricky. I think you're trying to beat the system. So are you saying that, so if you have a business and you hire your child to do work for that business and your child will be paying taxes, then yes. So you can't say, okay, I am going to pay you today to take out the trash, clean the kitchen, and clean up your room. Those are chores. That's not employment.
All right. If a person may be qualified for EID, can your office help the person through the application process?
Most definitely. And if we're not in your area, at the end of this PowerPoint, I have where you can connect to your CIL. So there are 7 CILs in the state of Maryland. And so if you are not in Prince George's or Montgomery County, you can call the CIL that's nearest you and they'll be more than willing to support you.
Great. And then one clarifying question. Are the $20 and $65 per month sums deducted from monthly earnings and the result counted as one's monthly income? This person had trouble following that.
I'm sorry, I know I talk a little bit fast when I do these PowerPoints, mostly because I'm a quad and I'm losing breath. So they take your monthly income and they deduct that 20 and then they deduct 65, and then what's left is how they calculate your what your payment would be. So it's just a deduction that works out on your behalf.
Awesome. Thank you so much. Oh, one more person. Okay, last one, then we can move on. How about?
Okay.
Someone is asking what happens if you lose your job.
So if you lose your job, remember a couple of slides before I said, if you lose your job, you can still get EID for up to 6 months, but you have to pay those premiums. Now, if it's a hardship on you, what you do is you let your case manager worker know that you have lost your job, and submit proof that you've lost your job, and then they'll go off your income, and that can lower your premium. So
Awesome.
yes.
Great. Thank you so much, Shannon.
You're welcome. So we're going to go back to the slide now, you guys, right? So medical assistance. So EID is just medical assistance. We all should know a little bit about medical assistance. So it covers for people who no longer have insurance, supplemental coverage for those with private insurances for Medicaid. If private insurance denies a service, medical assistance may cover it. And so I'm a quadriplegic. I use a power wheelchair, and I receive Medicare. And so what prompted me to apply for EID is, when I go to get a new wheelchair, I have to pay like $4,000 because Medicaid only pays 80%. Medicare, sorry, only pays 80%. So I have that 20% that I have to pay, right? Well, with EID, I don't have to pay any of that. Like, they covers it completely. And my EID also covers my premium for my Medicare. So that saves me a lot of money, right? So it will save you a lot of money. And so some doctors that, I've needed to see that, Medicare won't cover, I've used my Medicaid as well. So just to give you a few examples of, exactly what that means. How to apply. So you can apply with the help of an agency by completing the EID application and obtaining the supportive documents, and you send it to the eligibility determination division. The application is not strenuous. All of the questions are very simple, but you can get someone that will sit down and help you. I've done it virtually, I've done it face-to-face, but right now, mostly, I'm doing them virtually. And, with the mail system the way it is, I've told people, you may want to get your, get it certified and sent, so someone has to sign for it because things are getting lost in the mail. And the last thing you want is for that application to get lost. So this is where you can go, the health.maryland.gov to grab the application. You also can go to MDOD's website. And if you go to their website, you go to employment, and then you scroll all the way down to the bottom and you'll see EID. And the wonderful thing about MDOD's website, and I use it all the time just so I don't have to go, finding it in, on the health department's website. They have, it's they have it all laid out for you. The application, how to apply, what are the premiums, what are the amounts you need to, what is the income requirements? Every single thing is there. They make it so easy. That's why I was like, oh yes, I'll do EID. Maryland Department of Disabilities just make it look great and easy. So call for help applying. A staff member will help you complete the application. So if you're in Baltimore City, this is the number you want to call. If you're in Prince George's or Montgomery, you can call this number. And then again, these are all sales, you know, in your area that you can call. And I can share this PowerPoint if you feel like, you know, I ran through it too fast. I talk fast. I've had my coffee, so I talk fast. Or you can just pick up the phone and call me, and I'm more than willing to direct you and give you the number to the person that you need to speak to that's in your area. If you want to make a referral to Independence Now, if you have someone that's in Prince George's County or Montgomery County that needs help with completing the application, you can just go to our website at innow.org. When you go to the website, you'll see a referral button. You can refer the person and say what it's for. You can just say apply for EID. That email will come directly to me, and I promise you I will call them within 24 hours and get them started on their application.
Fabulous. Thank you so much.
And this is how you connect with Independence Now. And any other questions?
Great. All right. So someone's wondering if there are any exceptions for someone 65.
I haven't heard of there being any exceptions for anyone that's over 64. I apologize, I haven't.
Okay, thanks. So if a person has Medicaid already, but does not have ability to work, do they qualify for EID?
So remember, EID is Medicaid. So if you already have Medicaid, you don't need to apply for two of the same service. It does the same thing.
Are there
Now the
incomes?
question is, why do you feel like you're not able to work? So that's what I would like to dig more into. A lot of people say to me, they call and they don't know that I'm a person with a disability. They don't know that I use a wheelchair 24/7. And they say to me, I can't work because I use a wheelchair. And so we had the whole conversation about going back to work and, you know, being a person with a disability. Never allow your disability to determine if you can go back to work or not. I can tell you some stories and I can help you, you know, reach that goal if you want to.
Beautiful, thank you. Are there incomes that are not counted as resources?
All of your income is counted as a resource except for that $20 and that $65. All of your income is counted.
All right. Okay, well, if there are no further questions, I did put my email address in the chat. So Shannon, you can share your slide deck with me. And if anyone emails me requesting a copy, I'm happy to pass that over. Oh, here's another question really quick.
That's correct. That's correct.
Oh, okay.
You want to read the question, Nora, or?
Sure, yeah, it says if you have some money in a special needs trust, it should not count, right?
Right.
Right. All right. Thank you so much. I really appreciate you joining us.
That was
This has
quick.
been
Like I
wonderful.
said, I talk really fast sometimes, and yeah, so hopefully you guys got to hear everything that you needed to hear. But please, 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 if you didn't, reach out to me, and I can support you the best way I can. Yes, ma'am, you'll have access to my PowerPoint. I'll email it to Nora right now.
And I'll put my email in the chat one last time so everyone has it in case you want to request a copy of the PowerPoint.
And again, I'm telling you, your best resource is MDOD website. If you've never been there, you must go to that website. Maryland Department of Disabilities website has a wealth of information and a lot of information about the EID program as well.
Absolutely. And you can email me with any further questions that you might have as well. All right. Well, with that, thank you so much again, Shannon. This is great. And I hope everyone has a lovely day.
You're welcome. Thank you so much. And thank you for coming, you guys. And hopefully you guys will partake in the EID program. It's a wonderful program in the state of Maryland.
Mm-hmm.